welcome to another episode of Ask the Experts with Mayor Broome and Healthy PR. Today we have a very important topic. We're going to be discussing HIV. We have an expert panel who's here to discuss resources and strategies, best practices around this topic, okay? So make certain that you like, follow, and share this conversation so you and your family members can get all this wonderful information. Without further ado, Ask the Experts.
Well, hello everyone. This is Mayor President Sharon, Weston, Broome, and I'm glad to have you join us on another episode of Ask the Expert. This discussion today is going to be around HIV testing in our community. And of course, residents throughout the parish are affected by HIV, regardless of their income, their zip code, where they live, their skin color. So it's imperative that the community take every action possible to end the HIV epidemic. We'll be joined today by experts from our community who will help us understand why HIV testing and awareness is so necessary and provide some insight on how Baton Rouge is making great progress in the fight against HIV. Now to my panelists. I am going to start with Slyvia Andrews. And Slyvia, thank you for joining us today. Tell us a little bit about who you are, what you do, and why this is so important to you.
Thank you. Thank you for having me participate in this panel. I am Slyvia Andrews. I work as a director for the Focus program with Gilead Sciences. It's a public health initiative under Gilead, and we support healthcare settings and community-based organizations increase HIV screening, diagnosis, and linkage to care according to the CDC's guidelines.
How long have you been doing the work?
It's year 7 for me, doing the work directly with Gilead. Before that, I served at the City of Baton Rouge, overseeing the Ryan White program.
Awesome. Thank you so much, Slyvia.
Thank you.
And now to Mr. Issac Gulliard. How are you doing today? And tell us a little bit about yourself.
I'm blessed, and thanks for having me. I'm Issac Gulliard. I'm the Community Health and Outreach Supervisor with the Louisiana Department of Health, located in East Baton Rouge Parish.
Thank you. And why is this issue important to you?
This issue is very important to me because I am living with HIV. I've been living with HIV since 2005. Thriving, and I've accessed services within the local area from all of the community partners. So it's something that comes from the heart, and I'm very passionate about ending the HIV epidemic.
And I appreciate your transparency. Thank you so much, Issac.
Most definitely.
Last but not least, we have Cherie Ruiz. Cherie, tell us a little bit about yourself.
My name is Cherie Ruiz. I'm a nurse at Ochsner in the emergency room, and I work as the care coordinator for patients with HIV and hepatitis C.
Well, thank you all so much. And so we're just going to have a conversation today, but the end result is that we want our listeners to be informed and empowered with this information. And so, Slyvia, what is HIV and how is it transmitted? What is the prevalence of HIV in East Baton Rouge Parish and Louisiana? And I know that might sound like, what is HIV? Well, believe it or not, there is still some confusion in the minds of many individuals in terms of what HIV is. So would you give us some clarity on that?
So HIV is a virus that attacks the immune system, and if it is left untreated, it turns into AIDS. So it is acquired through sex, through mother to child transmission. If the mother is HIV positive, she can pass it on to the child either through childbirth or breastfeeding, and also through sharing needles and other drug-related equipment. And this is a huge problem in Louisiana as a whole, but more specifically in Baton Rouge. For the state is ranked as 4th across all states for both HIV case rates as well as AIDS case rates. Baton Rouge in particular is still number 3 in the country amongst large metropolitan areas. And through some of the work that we've done under your administration and the former, we've been able to increase testing, catch disease earlier, and we've dropped from #1 in AIDS case rates to #10. So that's a huge accomplishment.
And I appreciate you bringing that out because, you know, when there are a lot of different things going on in the city, some issues don't get the high profile as other issues. For example, for a whole year now, we've been dealing with COVID-19, right? So that's been the dominant theme of conversation.
Right.
But just as you said, recently in the past year, right before COVID, we reached a milestone in that we shifted from #1 in AIDS to #10.
Right.
And so why is testing so important? We had a little sidebar about testing a few minutes ago, but why is it important and why should people know their status?
Yeah, so testing is important, especially the type of testing that we're doing, especially in our hospitals, which is routine opt-out screening.
Explain that, Sylvia, what that is, routine
Yeah,
opt-out.
so opt-out screening is where you inform the patient that this is a part of the standard of care, and everybody will get a screen if they fall within the CDC's guidelines, and that's usually, 13 to 64, 65 for HIV. And because we have such a huge problem in Louisiana, many of our partners like Ochsner do screen 18 and older. So that's whether you think you have a risk or not, it just routinely gets done as a part of their standard of care. And that's really important because some people don't realize they have risk. If they're in a relationship with someone and they're monogamous, but their partner may not be or may have had an indiscretion at one time, they may have put their partner at risk. That partner may not know it. So anytime they engage a partner who is doing routine screening, they'll get screened regardless. So no judgment, no bias, no nothing. And that's really important in an area that has as high of a prevalence rate as we do. It's also important to know your status because if you're positive, you can get into care and you can adjust your behavior so that you protect your partners. And if you are negative, it helps you to continue those behaviors that have kept you negative. And even if you have some concern about exposure, you can seek out information from our hospital partners, our public health partners, to learn about the 1 pill a day that can prevent you from acquiring HIV. So it's really important for us to know.
Issac, let me transition to you. What do you consider some of the barriers or what prevents people from pursuing an HIV test?
Well, first and foremost, I think that perception is one thing. And one thing that plays on perception is something called stigma. And stigma is either internalized or experienced externally and internalized. And also people have had family members that have seen other family members have HIV, or just being young and thinking that they're not at risk and not thinking HIV test is necessary for them to live a life. I think that people think that it is something that scares them away as opposed to go towards. Like if you say you were giving away free money, yeah, they would run towards that. But when you say HIV test, it may pose a question: what have I been doing? Why do I need an HIV test? And I think that it starts to focus in on the self too, and then people internalize that, and then they start to think that they don't need to access HIV testing. So stigma is definitely what creates ignorance, fear, doubt, and that's let along transportation and other issues that people experience with access to HIV testing.
I was just going to talk about access, but all of the other reasons you gave certainly are insightful. Stigma, and that, I don't know where it ranks, but it's certainly, I believe, way at the top of the list is the stigma. And I noticed that there have been many efforts now to remove the stigma so people don't feel ostracized or people are looking at me. And and you all are the specialists, so correct me if I say anything wrong, but now because of medicine and medication, et cetera, it is not a death sentence. HIV is not a death sentence.
That's right.
No, HIV is not a death sentence.
Yeah, and so I think that's a part of the fear maybe of getting the test. And you said something else, access. Now that's something we deal with a lot of healthcare issues, the issues of equitable access in many instances. And so speaking of access, where do people go to receive an HIV test other than going to the emergency room?
Well, here in Baton Rouge Parish, there's a lot of community partners available. You can log on to the internet, go to louisianahealthhub.org, or simply getloudlouisiana.org, and you can go to the drop-down menu, find services. You can access HIV testing, STD testing, PrEP services, and also linkage to care treatment for people living with HIV.
Thank you. That's very insightful. Nurse Ruiz, what is, when we talk about increased access to testing, what is the medical community doing? I heard Slyvia talk a little bit about opt-out testing and explain that, but tell me some more about what the medical community is doing to increase access to testing.
So at Ochsner in the emergency room, every patient that comes in is screened according to the CDC guidelines for testing for HIV. And if they fall into that criteria, they're told about the HIV testing as a routine part of care, and they're given the opportunity to ask questions about it. And then they can opt out and say, no, I don't want that test, or remain and we'll do the testing for them. And then when the results are back, the doctor contacts them if it's positive. And we go from there. I link them to care to be able to get to someone to start their treatment.
So let's talk about care for a minute. How can HIV be treated? How do you treat HIV?
Okay. So nowadays, HIV is known as a chronic condition, a chronic disease, so to speak, just like diabetes and high blood pressure. And although there's no cure for chronic diseases, there are medications to keep them under control. And so if you have a positive status and you want to be treated for it, you can take one pill every day. So the amount of HIV that's in your blood, the amount of the virus that's in your blood is known as a viral load.
Viral load, okay.
And these medications lower the viral load in your blood, and that keeps your immune system strong. And once your viral load is so low that it is undetectable, then the virus can't be transmitted to other people, sexually that is.
One of the high-profile individuals who kind of help destigmatize HIV is Magic Johnson. Is that, would you say?
For sure.
And over the years, certainly, he has certainly been an ambassador on the issue, but certainly, as I said, he helped destigmatize and help people understand a little bit more about HIV. You all have a strong impact in your spheres of influence, whether it's at the hospital, whether it's at the state, or whether it's with the organization you work with. What are some projects and information that you would like our listeners to know about that are taking place in our community that may not be on their radar? Let's start with you, Slyvia.
So through Focus, we don't do a lot of community programs. We partner with community-based organizations, but I just want to thank you personally because of your advocacy and outreach. We've been able to partner with Ochsner, with Our Lady of the Lake, with Women's Hospital to do routine screening. And I think that as we have more conversations with primary care providers and urgent care centers, other healthcare settings to increase routine screening will definitely make a bigger impact in the community. But Gilead Focus does partner with community-based organizations to support their efforts in the community.
Isaac?
Yes, currently I'm supervising a team of community health workers that do HIV testing, STI testing here at the East Baton Rouge Parish Health Unit. Also, we have the opportunity of going out into the community to expand access for HIV testing by implementing the HIV self-testing in the communities and actually engaging and providing a service to the community that they would normally have to go and find. So it's wonderful to be out in the community every day and reach people that need resources. And sometimes, again, we work along 4 pillars of ending the HIV epidemic. That's diagnose, treat, prevent, and respond. And most of these people, we don't even address the needs for STI testing and HIV testing. Sometimes we just help them with the application or help them with food stamps or unemployment services. So there's a lot of work being done with the community health workers and our community partners as well, providing services and access for the community to receive HIV testing, screenings, PrEP services, and also treatment for people living with HIV.
Great. Nurse Ruiz?
And at Ochsner, we offer hepatitis C opt-out testing as well in the emergency room, so that if people use drugs and they're just concerned that maybe they've contracted hepatitis C, they can be tested there. And if they are in fact diagnosed with hepatitis C, I'm responsible for linking them to care.
People can come to Ochsner. Ochsner provides opt-out testing for HIV
as well as hepatitis C.
As well as hepatitis C.
Yes, ma'am.
That's good to know. Well, thank you all so much, and thank you for the work that you do. That's very important.
Thank you.
When I became mayor, I will tell you, I was extremely concerned about our HIV/AIDS rate, and I felt that there was not a lot of conversation going on and awareness about it because of the stigma. But we've moved the needle from 1 to 10, and we still have work to do. We're not going to stop. And thank each and every one of you for the work that you do to help us in this area. And thank you for joining us on Ask the Expert, and we'll see you at our next episode.
I would love to thank the mayor, Sharon Weston Broome, and her office and their Healthy BR initiative, and that they are here at the Capitol Park Museum, that we can partner and talk about a healthy mind and healthy body, and also all of the wonderful cultural offerings that we have here at the museum. I hope that you can come and check out our exhibition on Fonville Winans sometime soon. Thank you.